What is female erection? The truth often ignored. Many are surprised to learn that female erection is not a myth nor merely a comparison to male physiology. It's a real process that occurs in a woman's body during sexual arousal. Blood vessels, nerves, and hormones all participate in changes analogous to male erection, expressed differently. 1. Blood engorgement of sexual organs. When a woman is sexually aroused, the brain releases dopamine, oxytocin, and other neurotransmitters that activate the parasympathetic nervous system. As a result, blood flow to the pelvis increases, engorging the clitoris, labia, vaginal opening, and the clitoral erectile tissue. These are anatomical and physiological equivalents of the male penis. In women, these tissues swell, become more sensitive, and change in size and shape. 2. Vaginal lubrication. Increased blood flow activates the vestibular glands and cervical glands, producing natural lubrication. This lubrication is more than just moisture. It prepares for intercourse, reduces friction, prevents injury, and signals physiological readiness. Absence of lubrication may indicate lack of arousal, hormonal imbalance, stress, fatigue, or hidden conditions such as diabetes, hypothyroidism, or estrogen deficiency. 3. Sensitivity and erogenous zones. During arousal, the clitoris becomes 2 to 3 times more sensitive, it engorges and shortens. Vaginal sensitivity increases, especially in the G-spot area on the frontal vaginal wall. Other erogenous zones, nipples, neck, ears, inner thighs, also become more sensitive due to hormonal surges. This state, tissue excitement, sensitivity, and lubrication, is what defines female erection. 4. Physiological role. Female erection is not just about pleasure. It improves pelvic blood circulation, helping prevent congestion, uterine fibroids, varicose veins, and urinary tract infections. It supports healthy hormonal regulation, stimulating estrogen and progesterone production. It strengthens pelvic floor muscles and, after orgasm, promotes stress reduction, improved sleep, and recovery. 5. Why arousal may fail. If a woman does not feel aroused or lubricated, possible reasons include chronic stress, fatigue, lack of sleep, hormonal imbalance, low estrogen, high prolactin, deficiency of iron, B vitamins or omega-3, use of certain medications, antidepressants, contraceptives, emotional distance from a partner, or lack of stimulation of erogenous zones. Why women lose desire. Main causes female libido is not merely mood or chemistry between people. It's a complex system influenced by hormones, nutrition, psychology, nervous system, sleep, and lifestyle. Many women notice decreased desire with age or after stress, but in most cases, it's not age itself, but the result of accumulated internal disruptions. 1. Hormonal imbalances. Libido depends on the balance of estrogen, testosterone, and prolactin. Estrogen supports lubrication, sensitivity, and pelvic blood flow. Low levels, due to menopause or stress, lead to dryness and pain. Testosterone, present in women in smaller amounts, is the hormone of desire. It's reduced by contraceptives, post-pregnancy, obesity, or insulin resistance. Prolactin, elevated by stress, poor sleep, postpartum state, or thyroid conditions, suppresses testosterone and reduces libido. Thyroid hormones, T3, T4, also affect it. Low levels lead to fatigue and decreased interest in intimacy. 2. Chronic stress and emotional tension. The brain is the primary sexual organ in women. Anxiety, fatigue, and tension suppress desire. Stress triggers cortisol production, which inhibits estrogen and testosterone, raises anxiety, disrupts cycles, and diverts blood flow from sexual organs. 3. Sleep and daily routine disruptions. Lack of sleep or irregular sleep patterns affects hormonal balance. Melatonin production decreases, upsetting overall hormone balance. Testosterone falls. Insulin increases, promoting weight gain. Dopamine and oxytocin production drops, affecting pleasure and connection. 4. Nutrition and deficiencies. Libido depends on biochemistry. Without essential nutrients, desire cannot be sustained. Harmful foods, sugar, fast food, and excess caffeine cause inflammation, insulin resistance, and hormone suppression. Alcohol may relax temporarily but eventually harms sensitivity and hormonal balance. Recommended foods: healthy fats, avocado, olive oil, eggs, for hormone synthesis, B vitamins and magnesium, green vegetables, whole grains. Nuts, for the nervous system, zinc and selenium, nuts, seeds, seafood, for testosterone, iron, red meat, legumes, to prevent fatigue and support energy. 5. Age-related changes and menopause. After 40, estrogen and progesterone decline sharply around 45-50. Effects include vaginal dryness, reduced sensitivity, disrupted sleep, energy drops, lower testosterone, anxiety spikes, and mood swings. But with proper body care, nutrition, sleep, hormone support, and mental well-being, sexual vitality can persist into the 60s and beyond. 6. Medications. Some medications may suppress libido, including antidepressants, hormonal contraceptives, antihypertensives, and antihistamines. If desire drops after starting such medication, consult a doctor. Low desire is not laziness or imagination, it's a signal that the body needs restoration. In our next segment, we will explore how to begin this restoration. How to restore female libido. Food, body, mind. Female desire isn't spontaneous. It arises from hormones, brain function, nerves, and circulation, but it can be restored. We need to remove what inhibits libido and introduce what supports it. 1. Nutrition that boosts libido. Hormones, sensitivity, and energy come from foods: healthy fats, avocado, eggs, olive oil, fatty fish, coconut oil, daily servings. Zinc sources: shellfish, nuts, red meat, every other day. B vitamins: leafy greens, whole grains, eggs, fish, daily consumption. Iron: red meat, beans, beets, 23 times per week, paired with vitamin C. Omega-3s: fish twice weekly, chia or flax seeds once daily. Cut out sugar, fast food, excessive coffee, and alcohol. 2. Mind and emotions. Arousal starts in the mind. Safety, trust, relaxation are essential. Without them, desire won't engage. 3. Movement and body awareness. Physical activity improves pelvic circulation, reduces stress, and balances hormones. Recommended: yoga, dance, swimming, Kegel exercises for improved sensitivity. 4. Sleep and recovery. Adequate sleep restores libido by balancing testosterone and cortisol. Aim for 7.5 hours, avoid screens before bed. 5. Embrace female sexuality. Exploration of what feels good, knowledge of one's body, and gentle self-touch foster permission to desire. Remove shame, embrace your own sensuality. In conclusion, desire can be restored without medications or embarrassment. Start with self-care, nourishing food, movement, rest, and compassion for yourself. Female sexuality doesn't disappear, it waits for your attention and care.